Hello, Fred. I was wondering, you have the title of CTO at Intermountain Healthcare, and Mark Protz has the title of CIO, and I'm wondering, why do you need both? What is the difference between the two?
So Mark's role is many-faceted, but certainly to lead the IT or IS organization in keeping the business on track, day-to-day operations, development, software, meeting those business needs. But there has to be a place in the organization that we go toy with the future. What could we be doing?
Yes.
What could we do different? How could we transform healthcare, improve quality, lower cost, with the use of other technologies or other things that IS or, frankly, non-IS could do? Where and when do we get to go do that? So part of my job, I have two parts of the job. One's just making sure that everything meets standards and we know what standards are in the company for IS, and when we buy applications that they meet all the rules that we have in place. But the other side of my job, and I think probably both fun as well as important, let's go play a little bit with the future. Let's go toy with something that we could normally never bring into the company and try because it would be too disruptive, and see if it makes a difference. If it does, it's worth the disruption. If it doesn't, it's okay. It was interesting to try. We had to try and start. I call it stirring the pot a little bit, or using the crystal ball to see what we should be playing in, and that's part of my job as well. And so Mark is very supportive and very much about strategy and making sure that we're in line with our business while we're doing both, doing that and running over and figuring out what else could we be doing. Okay. How do you push the boundaries?
That sounds like fun. Sounds like a fun job.
It's a blast.
All right. Well, we're here at the mHealth Summit, and so I wanted to ask about Intermountain and its connection to mHealth. What types of initiatives do you have going, or maybe you can't talk about them all, but about maybe the one that is top of mind?
So it's probably from two angles. One angle is we're developing some apps that we would consider in that mHealth space, both physicians, and you'll see us do some things for patients, that we think are very much part of the mobile, new wave health market. But the other is, just like consumerization of IT, there's really getting to be this consumerization of healthcare and the devices that are going out and being in people's hands and all the data that's getting collected. Two problems with that data. Number one, it should be nice if we could get to it and if we could use it to change healthcare for us and how we treat patients. And the other is, a lot of data is getting collected by organizations that are not healthcare. And the question is, what do they do with the data? How do they make sense of it? And we think there's an opportunity for healthcare organizations to marry with partners who have all of this data from their devices and their customers in their cloud, and make a difference in how what we do with healthcare and what we know in advance, and how our physicians have more data to make better decisions on. Intermountain's known for having huge amounts of data and helping clinicians make better decisions because of that data. It's another data source. It's another future for that data source.
So are you forging those types of partnerships?
We're working on them.
They're in the works.
It's a difficult space because there's no one company that's kind of doing it all, so it would be a series of them. It's also a question is getting our physician population to trust that data. Today they come in, and if you come into a traditional exam and say, well, all my diabetes meter says my average is this, nobody trusts it. They don't trust what you're saying at the moment. And so getting trust in that data is another thing that we have to develop, so that as we go through all this, as we bring that data into the conversation of a clinical visit, that you can make sense of it.
And do you also see that data, because there's so much of it valuable for population health use?
We think so. I don't know that we've defined what that means yet.
Right.
But I absolutely believe...
It could be a small population.
Could be a big one.
Yeah.
But I absolutely believe the data, we will find analytical uses for it to create new protocols, new understandings of how people live their life and how we can affect care before it ever gets critical and winds up in one of our more critical, more costly settings. And just because it has the opportunity to reduce cost or how many people go into our hospital, Intermountain will still explore it and try to figure out how to use it, even though it may mean that we don't use so much healthcare.
So what is the big technology project that you're working on right now at Intermountain?
Telehealth would be the largest one.
Really?
From our perspective. Taking telehealth to its next level. We look at it a little bit differently. It's still telehealth, and I think everybody's thought about it, but we've approached it first from the patient's perspective, not from the traditional telemedicine, hospital, physician to physician, but how do we get patients into our, how do we get patients to enter the care or get better health sooner without necessarily walking in the door? And that's a huge project for us. And it spills into the patient to physician, and then it spills into what happens in everything from patient rooms to ICUs to everything that we traditionally think of when we talk about telehealth.
And are you thinking about the patients that are far away from your main facility, from more rural areas, more than you are of those that live, I don't know, a couple of miles away?
No, I'd say it's both.
Both.
I don't know that we have a great distinction, because even when the ones that have close access to it still won't go until they have to. And the question is, how do you get them to engage healthcare, A, when it's cheaper, and B, when we can have the greatest impact, which is before it gets too serious. And we potentially could have handled it with a simple prescription, or frankly, it is more serious and they do need to get to higher care, and we need to tell them that so they go before it gets worse.
Yeah.
So not necessarily a focus, although given that there's a lot of rural parts of Utah, it's not a bad thing.
Okay. Thank you very much.